Today we're here with Phil Fogg, President and CEO of Marquis Companies. Phil, how did you get started in this profession? Were there any specific people or events that really drew you into this career?
Well, yeah, I'm a fourth generation nursing home administrator, so I was almost required at birth to go into the profession. I've met, by the way, other members who are fourth generation, but I actually have two sons that are licensed administrators, so I have a fifth, and I haven't met any fifth generations yet. But in all truthfulness, I started working in the facilities when I was in the sixth grade, and started doing laundry and housekeeping, and worked all the way through high school. And this was a profession that I knew I wanted to do since a very young age. So some folks kind of get forced back into it. I was a very willing person to get into this profession and love it.
What a great family legacy. Well, as chair of AHCA NCAL, what are the current initiatives and priorities of the association?
Priority one is that we've got to help our members recover from the pandemic and to recover from the current workforce crisis. Recovery from that pandemic has really got three buckets, and it's again, get the workforce back so that we can recover our occupancy, and then deal with the regulatory requirements that we've gotten, either temporary rules, guidances, or waivers that have come about because of the PHE. And we need to be able to have our members get some relief from the things that are creating onerous amounts of time.
Phil, in what ways is the association working with members to address these two big challenges?
I don't know if I'd call it working with members. I'd say what we're doing for members. And really what we have right now is we have a general workforce issue that's hitting sectors across all businesses. That's an issue that I think will ease over some time. The licensed nurse shortage, I doubt is going to go away. And what we need to be able to do is to increase the capacity of all of the workforce areas, but specifically licensed nursing. And so we need to focus on things like, and what we are doing is focusing on things like immigration. And then we need to increase the supply or capacity in the universities, colleges, and community colleges in America for licensed nursing. And I would say then there's other things that we're looking at today, like getting federal funding to high schools to have high school students be able to do like a vocational program where they get their CNA while in high school, and then start an LPN program and maybe finish it after school, after high school, but then that could be a bridge then to an RN. And so those are the types of things that we're really focused on right now.
Really large, long-term solutions.
Yeah.
Where do you see opportunities in the future of long-term care? Are there innovations, trends that are coming out of this pandemic workforce crisis situation that you find?
I think, and I know it doesn't seem very innovative, but this licensed nurse shortage was going to hit us whether there was a pandemic or not. The pandemic just exacerbated this issue, and I will tell you that if there's a positive, it's that it's created the crisis. We were feeling this in 2007 before the recession of 2008. And unfortunately at that time, the recession brought people back in the workforce and kind of covered up the challenge. And so this crisis is creating a call to action that I think is going to drive larger change and larger initiatives. I think that because of the workforce challenge, you're starting to see technologies deployed and ways to create more efficient environments within the facilities, using labor and workforce to their highest licensure, trying to find other ways to get things done. I think that we're adapting, and that's what we've been doing for the last 2 years, is adapting. But I think we could look back and say that maybe those were positives.
Mm-hmm. It really does speak to the resiliency that the facilities and the administrators are doing, that adapting and rethinking some of those workforce situations. What's your advice to AHCA NCAL members regarding getting involved in advocacy efforts, either locally, state, federal?
I cannot think of a more important time in the history of our profession that we need the engagement of all members. And it's both at a national level and it's at a local level. If we could get every congressional member into a skilled nursing facility one time a year, that would probably do more than anything else that we do on an advocacy level. And so inviting the congressional members into their facilities, educating them, helping them understand is just absolutely critical. Having said that, having a voice on the Hill and having real relationships with their legislators is equally as critical right now, and because they need to understand what we're going through and what our pathways are to recovery.
Absolutely, building those relationships, so critical. Well, thank you, Phil, for spending some time with us today and talking about AHCA and NCAL priorities right now.
You're very welcome.